Welcome to MedQuiz, where medical education meets professionalism. Join our community and elevate your knowledge with experts. Welcome to the fascinating world of antipsychotics. In this whimsical landscape, a chemically inflated cow stands before the typical building, symbolizing the typical class of antipsychotic drugs. As we step through the shimmering gates of the typical side, notice the tire adorned with a phenol symbol, introducing us to the phenothiazine derivatives. These medications, like chlorpromazine, are known for their tranquilizing effects and are often used to treat schizophrenia and anxiety disorders. To the left, a rather fat, jovial gentleman, dressed in luxury fashion, represents the aliphatic derivatives. His premium cloth magazine whispers the existence of chlorpromazine, a classic example of this subclass. Nearby, a group of travelers puffing on pipes embody the piperidine derivatives, specifically thoridazine, denoted by the tour group in the picture. These medications are known for their sedative and anticholinergic effects. And behold, the debonair ox with a tie that shines like stardust. This majestic creature represents the thioxanthine derivatives, with the tick symbol of thiothixine on its arm and the pen symbol of flupenthixol on its shirt. These medications are known for their potent antipsychotic effects and are used to treat conditions like schizophrenia. In our serene Zen garden, an elderly man plays bagpipes, surrounded by birds and artifacts with typical inscribed behind, illustrating the tranquil yet profound impact of these drugs. Let's cultivate a memory that will help you master piperazine derivatives. Observe the wise old man playing the bagpipes, representing the piperazine derivative family. Note the musical symbol with 3 notes beside him, signifying trifluoperazine, a potent antipsychotic with a trifluoromethyl group. The perfume bottle on the mat, perfenazine, adds a fragrant reminder of its use in treating schizophrenia and anxiety disorders. And look, the birds flying outside the garden represent fluphenazine, an antipsychotic with a phenothiazine structure, taking flight in your memory. Observe the Bell-Gap bus with 4 lights on its anterior symbolizing the butyrophenone class of antipsychotics. Above the bus, an angelic child embodies the butyrophenone derivatives. The halo symbol on his head represents haloperidol, a classic example of this subclass, known for its potent antipsychotic effects. The name Ben on his shirt signifies benperidol, another important medication in this group, recognized for its efficacy in treating psychotic disorders. And the Dun sign atop the bus symbolizes domperidone, a medication with a unique mechanism of action, often used to treat nausea and vomiting. Meet Molly, a visual mnemonic to help you remember key antipsychotic medications. Molly's name represents molindone, a crucial medication in this class. Her dreadlocks or locks symbolize loxapine, another important antipsychotic, and her shushing action, placing her finger on the toddler's lips, represents pimozide, a medication known for its calming effects. Meet the atypical antipsychotic agents. Let this unusual scene stick in your memory. A sneaky man, zipped up in his hoodie, quietly snatches a bag of rice in broad daylight. That's right, in the middle of the day, with no shame or fear. It's an atypical move, just like this group of medications. And what's in the background? An airplane taking off and a signpost pointing to close. Notice how out of place this scene is. That's the point. Just like how atypical antipsychotics deviate from the typical class of medications, this man's behavior defies the norm. Associate each element with the corresponding medication. Ziprasidone, zipped hoodie, quetiapine, quiet action, risperidone, bag of rice, aripiprazole, airplane, and clozapine, close signpost. Now recall the atypical antipsychotics with ease. Risperidone, quiapine, aripiprazole, clozapine, and ziprasidone. This visual mnemonic will help you steal the show in your pharmacology exams. This scene with a truck with a mechanic standing beside it, representing the mechanism of action of antipsychotics. The typical antipsychotics work by blocking dopamine receptors, specifically D2 receptors. However, this blocking action can lead to extrapyramidal side effects, as represented by the pyramid with the T symbol at its peak. Atypical antipsychotics, on the other hand, can block not only D2 receptors, but also other receptors like serotonin, HT2, muscarinic, and more. This makes them a better option for refractory cases that are unresponsive to typical antipsychotics. The atypical signpost, pointing away from the pyramid, indicates fewer extrapyramidal side effects. The The pyramid has a plus symbol on it, suggesting the typical antipsychotics can alleviate the positive symptoms of positive symptoms, while the A-labeled signpost has a plus and minus symbol on both sides, suggesting the atypical antipsychotics has effects on both the positive and negative symptoms of psychosis. So to summarize, typical antipsychotics block just D2 receptors and have extrapyramidal side effects, while atypical antipsychotics block multiple receptors and have fewer side effects. This makes atypical antipsychotics a valuable treatment option for difficult cases. In this scene, we'll explore the various adverse effects of antipsychotic medications. To our left, we have a man experiencing muscarinic effects. He's stooped down, struggling with constipation, and holding his stomach in pain due to difficulty urinating. His tongue is out, indicating dry mouth, and he's wearing glasses to compensate for loss of accommodation. Next to him, a woman is wearing a wooden face mask representing the mask-like appearance of pseudo-Parkinsonism. Her black top has a creamy stain, symbolizing galactorrhea, and her white skirt has a red stain, indicating amenorrhea. Her prominent mammary glands represents weight gain, and she's trying to stimulate the man on the stretcher, who's experiencing failure to ejaculate and infertility. The man on the stretcher is dealing with orthostatic hypotension, as seen by the blood pressure cuff on his arm. He looks confused, representing toxic confusional state, and has his hands up in the air, indicating tardiac dyskinesia. Thanks for watching. Don't forget to like and subscribe.